India's COVID crisis is spilling across its borders, with its neighbour Nepal suffering a 1,200% rise in cases. Friday's record new case count is almost 9,200, according to the Health Ministry. And for the fourth day in a row, 50 or more people there have died from the virus. Hospitals in the poor, mountainous country rapidly running out of beds and oxygen. Crematoriums and temples at full capacity, leaving residents of the capital to cremate bodies of coronavirus victims out in the open. The Prime Minister this week pleaded to the international community for help.
Pandemic like this spares no one, and no one is safe. It is in this vein I would like to request our neighbors, friendly countries, and international organizations to help us with vaccines, diagnostic equipment and kits, oxygen therapy, critical care medicines, and critical care furniture to support our ongoing efforts to combat the pandemic.
Now, a month ago, Nepal was reporting about 100 cases a day. Right now, 2 out of 5 people testing for COVID are coming out positive. And I'm joined now by Nepal's Prime Minister, KP Sharma Oli. He comes to us live from the capital, Kathmandu. Mr. Prime Minister, thanks for your time. Our condolences to your nation for losses to this virus. As to the numbers, on Friday, Nepal, a record new number of cases. How is your country placed to handle this surge in terms of resources and medical infrastructure?
Thank you very much. And you already gave some background also, and my call to the neighbors and international friendly countries and organizations for help COVID vaccines. Right now, of course, the pandemic is spreading in Nepal, like some other countries in our neighbors also. The COVID-19 situation in Nepal is under control now, we must say, and we have 78,629 active cases. As of now, recovery rate is 68.6%. And
right.
As of yesterday, 8,579 people lost their lives. It's a very huge number for our situation, and we are very worried about this, and we are trying to control, which is 0.95% of total cases. So less than 1% mortality rate is now, and we are taking very serious measures to control the situation, to supply oxygen, to supply beds, to supply ICU beds and other facilities to the patients and ambulances in the city areas. Mostly in the city areas that it's spread. And we are trying to control it and using our strength, and we are concentrating our entire efforts to prevent from the disease. And we are launching different programs to aware the people and firstly to combat with this or any type of pandemic, first thing is awareness of the people and to protect the people from being transmitted.
Right.
So we are concentrated in this.
If I can ask, I mean, the numbers are really worrying. A month ago, Nepal had 100 cases a day. Friday, more than 9,000. I mean, last weekend, I think 44% of Nepal's COVID tests came back positive. What went wrong, and what can you do to reverse this?
Last year, we were able to control the pandemic and its spread, and we controlled. The mortality rate was in 0, and the transmission rate also was around 50 per day. And the negligence among the people was increased, and because it is people thought that it is controlled already and there is no problem. So for this reason, again, contamination and the transmission from one to another, it got opportunity. So it took again second wave of the problem. So we are now are conscious and concentrating our efforts to make the people aware and protect people from being transmitted.
I understand. I mean, one thing I wanted to ask you, because I know your time is limited, many big public events went ahead last month. There are festivals scheduled for this month that haven't been cancelled. I mean, do you think that's a mistake?
What about?
There were many festivals and events that were held last month. Do you think it was a mistake to have allowed those to go ahead?